Ali Guajardo, LCSW. My pronouns are he, him, él. And today, for this training specifically, I'm going to be pulling from 5 years of being trained in EMDR and 3 years of being trained in DBT. I have been able to implement these skills for a variety of reasons. One, to reduce emotional dysregulation, support in crisis, and to reduce physical and emotional trauma responses that I see in folks that I work with. In my experience in doing this work, I have found that DBT and EMDR tend to be the most effective in treating complex trauma. And given that a lot of the communities we serve are marginalized communities navigating intersectional forms of trauma, I have found like DBT to be extremely validating, providing skills, and EMDR to really help reduce any trauma response we might have, or like a strong emotional charge. So overall, I do feel like these two models of therapy are very beneficial for BIPOC and LGBT communities. So looking forward to sharing all these skills with you, and I'll be providing some, case examples of how I have been able to implement this and how it's been effective with some of the people we serve. And Bella, hand it over to you.
Thank you, Ali G. Ali is going to be our man for today. A lot of the training today is going to be based off of his work as a clinician. I am here as a support today. So I'm Bella. Many of y'all already know me. If you don't, I am a researcher at the University of California at Santa Barbara. My work looks at the criminalization of marginalized communities. My current project looks at the criminalization of Latina foster girls. And really, I specifically look at the way that mental health services become part of what we call the carceral continuum, right? So they become part of larger systems of incarceration and of disciplining, even if it's not, prisons themselves. So my research is really about thinking about the way that criminalization moves through all kinds of spaces within the helping field. And if we can go to the next slide, today we have some really helpful tools for you. So today's session, this is part 5 of this 8-part series. We are more than halfway done, which makes me kind of sad, but also excited. So today we're going to be orienting ourselves and y'all to EMDR, which is eye movement desensitization, reprocessing, and dialectic behavior therapy, so DBT. Really what we're hoping to get out of today's session is we are hoping that you will walk away with tools that can help you deactivate a crisis situation that is active and that you are responding to. So we were going to review the stress model of crisis with the brain states. So if you weren't here during the session where we talked about the brain states, I recommend going back and freshening up a little bit. We will talk about it a little bit today, but this session it's kind of connecting a lot of the things that we've talked about already. And we're also going to go over some DBT skills to have on hand to de-escalate. These include a skill that's called TIP, and EMDR skills to de-escalate. And we'll be talking about bilateral stimulation today, specifically in regards to EMDR.
All right, so right here, what you see on this slide is going to be the stress model of crisis. This stress model of crisis is pulled from the therapeutic crisis intervention training developed by Cornell University, which kind of helps us understand the person in an effort to implement de-escalation techniques and provide moments of coaching and teaching skills. We went ahead and added the brain states to help kind of put things into perspective. So what you see here is, our baseline, which is where we are kind of operating when we are in our normal state. Ideally, we are in our executive brain. We're able to make decisions, think fully, think of consequence, think logically, overall wise mind. So yeah, this is where we're in our normal baseline, and ideally in the pre-crisis state, this would be a really good time for us to start to build a safety plan, right? To be preventative in that if a crisis were to occur, we would already have some information, some skills, some strengths that we can build on. Then we have an event, right? Where someone is triggered. That event can be when someone feels challenged, when feelings of frustration come up, when we're stressed. This can be related to what we see for PTSD, right? Something in our environment or something in the environment has triggered us. This can also be, I've seen this happen where, a youth, that can be a child or a teen, doesn't get what they want, or, their mom's not letting them go out. They can't play their video games. And I think for when I was working with Wraparound, I saw a big portion of like 10 and 11-year-olds who were, losing it when they couldn't play the video games or get what they want. Then we'll see that kind of, so the agitation begins, then we'll see the escalation phase. And this is where we're kind of seeing that the emotion brain is really, really activated here, right? They're feeling a strong emotion and it's causing them to act in an aggressive way. This can be verbally, non-verbally. Some of this can look like withdrawal, right? Some folks, it's not aggression in that outward aggression, it's more of an inward, but they're definitely in that emotion state. This can also look like, yelling, cussing, name calling. There was a youth I shared with you all in one of our last series, right, where he would get agitated by kind of seeing his ex-abuser, and then the grandmother would report that after that he would start to make verbal comments and kick things and start throwing things, but not directly at anybody. And then 2 hours later, this is where he hit the outburst area. So this is when the verbal and nonverbal actions become dangerous and unsafe. And this is when we want to ideally intervene, right? But again, understanding the brain states, we're going to recognize that when they are in the outburst crisis part, that is that survival brain is active, right? There is no thinking, there is no emotion other than fight, flight, freeze, and it's you versus me. And in the stress model crisis, they talk about this period of time for the outburst ideally can last about 20 minutes. Now, again, this is going under the understanding that someone's not on mood altering substance, like a meth or a drug like that, where that outburst, that crisis, someone can rage for a really long time, but ideally it's about a 20-minute span. So again, in that brain state of survival, what is our goal? Our goal is to ensure that they feel safe. So that is removing everything that's triggering, making sure people are out of the way so that no harm is done. And then we allow that kind of violent outburst to kind of play itself out, because again, the body will tire itself out, and then the person will enter a state of recovery, right? Again, ideally going back to that executive brain where now they're putting things into perspective. Oh my God, I just hit my grandma. Oh wow, I really said those things to that person. I didn't mean it. Right. And so this is the point where we can then start to implement some of the skills that I'm going to teach you today, because we cannot implement these skills when it is survival brain. We can implement these skills when it is an emotion brain, right? So taking into account intersectionality, where we're talking about the layers of identity that may be impacting them, are then going to be the things that we can validate. So if we kind of catch someone here, they're kind of already getting aggressive, we can start to, what I'm going to teach today with DBT is emotion regulation, right? This can be the part where we really can intervene and bring that person back to baseline before it hits the outburst. But again, if we are in the outburst, we need to just ride it out and wait till they get to recovery before we can then start to implement some of the skills that I'm going to teach today.
Sorry, Ellie, to quickly reiterate, right? So the idea is that if we can intervene at the triggering or escalation phase before we get to the violence or to the outburst phase, then we can avoid some of those really large, violent outward displays of crisis emotions. The tools that we'll be teaching today will try to help give you, or will give you tools to intervene at this phase before it turns into the full-on outburst crisis. And you can also use them or implement them in the recovery phase after the crisis has run its course.
Right. And so, in Wraparound, when I did this work, we would see a crisis and people would see it as like, oh, it's so horrible this happened. And yes, I agree. Nobody wants, to undergo this amount of stress and to have to deal with this. But at the same time, I would always tell a family, these crises teach us something. Right? There's something to be learned in these moments. So ideally in the recovery stage, we now have an opportunity to learn from the crisis experience. And then we, as the helper, whoever we may be, that may be a clinician, that may be a peer support, a paraprofessional, the probation officer, can come in and kind of now teach a skill or coach a person on these skills. So we just wanted to put this out here to kind of remind you all that when we're doing crisis work, we're either entering one of these three stages, right? The triggering event, the escalation of that, or the outburst. And then thinking about our act quick, right, where it says that after the crisis, then we're going to want to talk, we're going to want to, become solutions focused. All right, dialectic behavioral therapy. What is it and why is it important? Well, again, I got trained in it 3 years ago, and not knowing how effective or how important it was going to be in the work that I do in transgender healthcare. But it is an evidence-based psychotherapy that began with efforts to really support and treat personality disorders such as borderline personality disorder. It also helps with interpersonal conflicts. So there are evidence that DBT can be useful in treating mood disorders, suicidal ideation, and change behavior patterns such as self-harm and substance use, right? So in the 1980s, Marsha Linehan had kind of developed dialectic behavioral therapy. She was kind of building off of cognitive behavioral therapy. But one thing she noticed with cognitive behavioral therapy is that it really didn't work for mood disorders or people that were vulnerable. That's kind of a terminology that's used in DBT, people that were susceptible to high emotions, right? And kind of thinking about the brain, right? The emotion brain, that the more experiences we have on a feeling, the stronger our emotional charge is going to be. If I have a history of being neglected, anytime I feel neglected in my life, I may be more reactive. I may have a stronger emotional charge. So there are 4 components to DBT that are taught in the model. The first one is going to be mindfulness, which is the practice of being fully aware and present in the moment, right? And in next session, I'll kind of dive a little deeper into that. So for today, we just need to know that it is a component of DBT. Distress tolerance kind of teaches us how to tolerate pain in difficult situations and not just change it. So this is kind of where we see a lot of crisis situations come up, is that there is a very difficult situation or emotion that's come up and people want to change it. And sometimes we can by removing ourselves from that situation, but most of the time these things are out of our control. So we have to use our distress tolerance skills. Interpersonal effectiveness is not one that I will touch on in these trainings, but again, definitely worth exploring. And we have handouts in our link tree. So the interpersonal effectiveness skills teach us how to ask for what we want and say no while maintaining self-respect and relationships with others, right? Those that tend to be more susceptible to mood disorders, kind of have those highs and lows of their baseline, kind of an extreme emotion or feeling really down, tend to act impulsively and then can then act out and rupture some relationships. So in the dialectic model, we are teaching the skills for how to be effective, even when we can't get what we want, but we want to maintain a level of respect for everybody. And then emotion regulation, right? Again, kind of thinking of that emotion brain. How do we bring someone out of emotion brain? They need to feel connected, accepted, loved. And we do that by being able to validate any emotions they're going through. And again, keeping in mind that intersectional lens that, for example, a Black woman who's experiencing something may be because of her race, maybe because of her sexuality or her gender. And so when we can validate all those layers, we're going to get more emotion regulation. So emotion regulation overall teaches how to change emotions that you want to change. So these are kind of the 4 core principles of dialectic behavioral therapy. Today, for the sake of crisis response, I'm going to teach us, we're going to dive a little bit into emotion regulation and then definitely end on distress tolerance. All right, so this here is a nice little diagram that was created already online, so I didn't have to create it, but it talks about like emotion regulation. If we can't, our emotion dysregulation means we're going to have a problem behavior, right? If I can't control my anger, I'm probably going to break something, and that's a problem. Or if I'm attempting to regulate with like cutting or, cussing someone out because, again, I'm trying to regulate my emotions, we're going to see a problem behavior. So the core theory behind DBT is that some people, like I said, are more likely to react more intensely towards certain emotional situations. Emotion regulation skill, the goal is to regulate emotional regulation is to reduce emotional suffering. The goal is not to get rid of the emotion, because again, our emotions teach us something. They play an important function in our life. These skills help us change unwanted behaviors, right? If I don't want to like throw things when I'm mad because now I broke my phone and I got to buy a whole new one, that's going to suck. It reduces the emotional, my bad. Yeah, it helps us change unwanted emotions, reduces the vulnerability to becoming extremely emotional, increases our emotional resilience, right? If we can learn how to move through our emotions in a healthy way, we're going to be more resilient. I always say the more skills we have in our pocket for emotion regulation, the more opportunities we're going to have in our life. And that is something I tell my patients all the time, because we are living in a world where these things are going to come up. And Bella, did you want to
Yeah,
comment?
I always have something to say. I also just wanted to say here that, I think that when we're talking about something like DBT, when we hear things like, this is helpful for people that are more susceptible to high emotions. This doesn't necessarily mean that there's any, that it's like a personal fault that they're more susceptible. No, what it means is that they've had life experience very often with systems of oppression. It may have been a traumatic childhood, different experiences that create the realities within our brains that make it difficult to regulate emotions because we have so many more emotions that are informing the behavior. So this isn't to say, right, that people are, inherently flawed. And so some people are just more emotional. No, what this says is that people that have experience with trauma are going to have more difficulty regulating their emotions, and they deserve skills. They deserve tools to be able to regulate their emotions.
Yeah, thank you for that, Bella. Right. And again, understanding our emotions and being able to name them has so much power. There's power and knowledge and power. But anyway, our emotions, ideally, they motivate our behavior, right? They communicate to another person, but they also give us signals and alarms that something is happening. So when we are in tune with our emotions, we are going to be able to validate, to process, and overall maintain our baseline without hitting that space of agitation or aggression. Um, Again, what can make motion regulation hard can be that, and actually we can go to the next slide here. Things that can make it difficult can be not knowing what to do with our emotions, not knowing how to process the emotion effectively. Our mood controls us instead of our wise mind. And it overall can help us, arousal can cause us to reach a breaking point. So as I said, switch gears on the slide here, jump the gun. But so overall to say that we have a lot of handouts on this on emotion regulation that kind of have some good skills there. It'll be like, the emotion and when it's appropriate to feel it, where our body will feel it, and then how we can combat that feeling. So there are really good handouts in the DBT book that we have in our reference page there that you can look at or we can talk about after this session here. But overall, if we can validate someone's emotions, then we can bring them out of a crisis. And then that allows us to teach or coach on the distress tolerance skills. So distress, when do we use distress tolerance skills? It's when we got that intense physical or emotional pain. The emotional pain is too strong and it feels overwhelming. When we have a strong urge to engage in unskillful behaviors, when we need to be productive, but our emotions are overwhelming. So overall, distress tolerance skills help us to tolerate and survive the crisis without making it worse. Right? Again, these emotions aren't going to go away, but we don't want to act impulsively so that we, create more of a crisis for ourselves. This can be helpful for two reasons, according to DBT, right? One is that kind of says that, again, living in this world, pain and distress are a part of life. We cannot stop that from happening unless we, put ourselves in a vacuum and don't have any connections with anybody. Sure, maybe that won't happen. But at the same time, we're going to feel a little sad, a little lonely. And life is a beautiful thing when we can, have relationships with people. Again, the brain is hardwired for connection. So we do need connection. But what that means is that there is going to come a point in time where we experience these difficult emotions. So they cannot be avoided. They cannot be removed. the ability to accept and increase, the distress tolerance kind of teach us to accept so that we, again, they're not holding on to that suffering. And second, distress tolerance is an attempt to change ourselves. Again, we want to be more in control of our emotions. And I'll pause here just because there's something in the chat.
So Paula says, a psychologist I know uses the emotional regulation components with all of her clients, even though she does not use DBT as a therapy because she feels it is so useful for so many people. This is exactly Ali's, this is his stuff, right? That's exactly what he does. He identifies himself as an eclectic therapist because he pulls components from several different forms of therapy. And for DBT, it does seem like these emotion regulation skills have been something that have consistently proven to be incredibly helpful. Paula says trauma history is just the mother lode of needing emotional regulation skills and not usually having them modeled for you 100%. But emotion regulation should be normalized for all kinds of work, part of the understanding of what it takes to work with human beings, even at lower levels of stress and crisis mode. I agree with this 100%. And if we think about last session, right, where we talked about, where we talked about thinking about how conducting assessments can be something that we do for the people that we work with, but we should also be assessing ourselves. This is part of it, right? What are part of the assessment that we should be thinking about when we're assessing ourselves are what are my emotion regulation skills? Because if you're a clinician, if you're working in centers, all of the work that you all do can be incredibly taxing. It's incredibly heavy. The clinicians that I talk to with my research, so many of them talk about how difficult this work can be. And what is coming up consistently is that clinicians that have healthy coping skills are able to do more trauma-informed, more person-centered work because it's not their emotions that they're responding out of because they're able to regulate them. Paula, thank you so much for that point. That's really important.
And
sorry, Ali.
Anna definitely just added that this, DBT can be helpful for substance abuse treatment, right? Which is kind of where DBT was kind of focused on that as well. And again, when we're thinking about like LGBT communities, right? In my work, I see DBT kind of says that the more invalidation we have in life, again, they could not determine like what causes borderline personality disorder, but one thing they found was that folks that tend to have borderline personality disorders come from invalidating environments. Well, when I think of LGBT communities, right, it's like there is a lot of invalidation, whether that's society, whether that's in the home, whether that's someone not respecting your pronoun or seeing you for who you are. All of these moments can be extremely invalidating. And when we feel invalidated, best believe our emotions are going to go up, and it is going to be harder because that intense pain is so real that it's going to be harder to keep in control. So I agree with those in the chat, as well as what Bella said, is that I use DBT skills for almost every person I see, whether it is depression, divorce, navigating like a transgender identity, substance use, even elderly populations that I'm working with, we're using these skills. And I use these skills almost every day in my own personal life. You can't control how family acts, but I can control how I choose to cope with it. So I have my little pocket of distress tolerance skills every time I go to a family event. So thank you for the chat there. All right, so now that we know the importance of emotion regulation and that distress tolerance is a skill we need to have if we are going to live in the world and interact with others, then let's go ahead into the next slide, because there are two specific skills I want to teach. The first one is going to be the stop skill. It's probably the one I teach the most. All right, so this little handout says stop, take a step back, observe, and proceed mindfully. It seems so easy, and this kind of reminds me of an SNL skit that's like, just stop it, right? Never works to tell someone just stop it. So we would not want to use this when someone is heightened in that crisis. Just use your stop skill. No, you're going to make a situation worse. But again, once we get to that baseline or prior, we can have this discussion about how the stop skill can be helpful. So stop is kind of like what it sounds like. Just stop in your tracks. The S, kind of stop. Your emotions may make you act without thinking, right? And we always want to be in control of our emotion, because when we're in control, we can be more effective. So again, to stop is to just, so that we don't act impulsively. Take a break, take a breath. Don't let these feelings make you act impulsively. So sometimes just stopping, taking a breath. Again, when a situation happens, our and it causes anxiety, right? Whenever we feel anxiety, one of the biggest coping skills we talk about is like breathe, right? Do some controlled breathing, do some bubble, circle, square breathing, because being able to take that breath, again, it combats the survival brain that's changing your heart rate, your temperature, the way you breathe. So when we take a pause and we can breathe, already we can kind of feel relaxed and like, okay, let me ground myself. Then we want to observe what's kind of going on intentionally and externally, right? So take a minute, think about like what feelings are coming up for you. What is this event triggering? What was it about the situation that bothered you? Um, and just from my own personal experience, right, I've shared with you all that I've been in foster care. So in moments when I am told like you can't see your family for whatever reason, I know that takes me back to the age of 12. So I can get very reactive, very angry when someone tries to keep me from my family. Um, but I'm like, okay, let me use my stop skill. Like, stop. Okay, now this is reminding me of my childhood. Like, I just want to see my family. So, okay, how am I going to go about this? So then that P is like proceed mindfully, acting with awareness, considering our thoughts and feelings, thinking about our goals and asking what actions will make this better or worse. So again, kind of using that problem solving skill. So this is our stop skill. Again, it sounds so easy and so simple. And this is where sometimes it can feel a little ridiculous when I teach it. Sometimes they're like, wait, so you just want me to stop? And I'm just supposed to like take a breath and like explore how I'm feeling. And I'm like, yeah, that's exactly what I'm asking. And again, I use this skill with everybody, but the last session I had was a mother whose daughter crashed her car for the first time. And the mom got the call from her daughter and she was extremely like, right on her, as she was sharing it in session, she's like, it triggered my anxiety, like I was so scared for her. And then she's like, and I started having judgments about myself, like as a mom I gave her a car but I didn't teach her what to do when an accident happens. So we're processing this in session, but she started crying because she's like, I feel like a horrible mother because when she called I started yelling at her like, why didn't you get his license plate? And the daughter just hung up on her. Right. And so I said, oh, well, we've talked about our stop skill. Like, what do you think of this being a skill we can use in the future? Like, let's play it out. And so she's like, well, if I had stopped taking a breath, I would have noticed that I was having anxiety because my daughter was in an accident and that I'm feeling judgmental of myself as a mother because I didn't teach that skill. And then she said, and maybe in the call, I could have said, all right, this is scary. She's like, I could have validated my daughter and just said, let's plan what we want to do. Okay. What steps did you take? And then again, that would have caused her daughter maybe to not hang up on her and then her not feel like a bad mom. So very small example, but just wanted to put that out there.
And I also wanted to say that, not every crisis situation is the same, right? For a lot of you, the work that you do, if a crisis situation comes up, this skill may not be useful. But if you have ongoing communication with the folks that you're working with, if you have an opportunity to teach skills before the crisis situation even comes up, having this skill in their pocket can help avoid any kind of big emotion escalating into a crisis. So if you do have the opportunity to work with communities, before they get to the crisis situation, maybe when they're in executive brain in their everyday lives, this is such a helpful skill to teach early, right? Before the crisis even starts, when they're at baseline. So as y'all are thinking about this, the question is again, can you think of a time where a stop skill might have been useful for you, either in your personal lives, if you want to share, at work, for a client, whatever feels good for y'all to share. And while y'all are sharing that, I also just wanted to say that the stop skill really helps us answer the question of, do we want to be right or do we want to be effective? So often when we have these kind of big triggering emotions that elicit big behaviors, right? Sometimes harmful behaviors, we're in this mind state of, well, I'm right? I'm right. I've been wronged. I'm upset because of X, Y, and Z reason. And my reason is, the all-consuming reason. The stop skill really helps us to take a step back to figure out, okay, maybe I am right. Even if I am right, what is the most effective use, of the skills that I have right now, of language right now, as opposed to just, coming out in these big outbursts.
And while you are thinking about that and writing in the chat, or if you choose to talk out loud, I want to say when we talk about substance use, right? Again, I'm thinking of a patient I used this with who is in recovery, but recovery is kind of in the sensitive place right now. The person still has active triggers in their outside environment. This person has an urge to want to, go back to doing what they do. Again, the brain is hardwired for when we feel this, we're going to do this. And we have been able to use this stop skill with this particular woman in recovery, where she gets triggered when she feels neglected by her boyfriend, right? Her and her boyfriend are both in recovery, and he is a sponsor and he helps everybody. But she gets jealous when he helps females because they met in recovery. And she's like, well, if he met me there, like he can meet anyone. Right. But she's also shared with me, like, I have abandonment issues, like I am insecure, I am jealous. And so anytime he would talk with one of his female colleagues or someone he was helping, she'd start getting jealous and accuse him and kind of come at him. And he told her, like, I can't live like this. If you continue to accuse me, like, I don't know if I can be with you. And these are his words. So he writes, I don't care if they have a penis or a vagina, I'm going to help them. And so she shared them. I said, one skill I think can be helpful. Are you open to learning it? She was like, well, yeah, that's why I'm here. And I'm like, okay, a stop skill can really go a long way. And so she's like, well, how would I do that? So I told her, you are already aware that you have abandonment issues. And these are her words, right? You're already aware that you're insecure and you get jealous of younger looking women. So if that's something you already know, and he's telling you that if you continue to accuse him and act out in this way, that he doesn't know how long he can be with you, then maybe a stop skill might be something worth learning. So I had a session with her last week and she's like, I've been using my stop skill and it's helped a lot. They also had a discussion about, hey, this is what it triggers for me. I trust you. It's not about that. It's just that I get insecure. And so she tells him now, like, okay, I'm getting a little jealous. I'm going to take my stop skill. And so she steps away. She goes to her room. She's like, yeah, it's actually about my past. My dad left me. He's not doing anything. So she comes back and then she uses another skill that I taught, which is act opposite, which is also a DBT skill. And so even though she's still feeling insecure and jealous, she'll act opposite. So that's kind of how she plans to proceed mindfully is, I don't want to keep creating crisis for us. Instead, I'm going to trust him. And even if I don't believe it internally, because of my experiences, I know that he hasn't done anything to, violate me, to cheat on me, to break this trust. So I'm going to like go and give him a hug and just tell him like, I love him. And I think it's so great that he helps everybody. So again, that's a skill we've been able to use. And she reported that was effective. But let's see what we got in the chat.
We have nothing. So
all right.
That's okay. Sometimes engagement days are just not where we're at. So that's okay. I think we can move on to the next skill.
Yeah. All right. The next skill is called the tip skill. So this helps us reduce extreme emotion mind really fast. So a little bit of understanding why tipping the temperature of your face with cold water can be extremely helpful. Why? Well, so cold water can work wonders, first of all. I always tell those, it's not necessarily the face too, but even, I have folks who are like, I just, a nice cup of beer after work, a cold beer really helps take the edge off. And I explain to them, it's because we're kind of tipping the temperature there. So maybe it's the beer, but I imagine that it's that cold feeling. But anyways, when we put cold water on our face and we hold our breath, what happens there is it creates a dive response. And what that means is that your body, when it feels the cold temperature change for about 15 to 30 seconds, it tells the brain that you're about to dive underwater. And when we dive underwater, it actually slows down our heart. It redirects the blood flow from non-essential organs and it redirects it to the brain and the heart, which is where we need that blood flow to go when we're overcoming a difficult emotion. Right. So overall, changing the temperature in our body, our face specifically is what this skill teaches, can help us regulate our emotions. But I can tell you, I have not been effective at using this with adults. I think we find it kind of hilarious. Like, well, I'm just going to go put water on my face or put some ice packs under my cheeks. Right. Some of them are open to it, but I can tell you this works more with the little ones that I've worked with kids. Right. Again, when their parent is recognizing that they're kind of hitting that agitation. Again, that little 10-year-old boy that I talk about, again, he taught me a lot in this work. But for him, when grandma noticed that he would start to become, agitated or aggravated, she'd have him come to the kitchen and he'd put little ice packs on his face, and then he'd go lay down on the couch for like a minute, and then he'd calm down. They tried it, they took this skill and they tried it in another way, which I was like, okay, I don't know if that would work, but the grandma would put an ice cube down his back when he was agitated. And again, I'm like, oh my God, how did that go? And she's like, oh, he found it so funny. And then they ended up like laughing and having a good time. So that grandma was able to like use ice down his back, and he was comfortable with that. Or he'd get his little like facial ice packs and put them on his face when he'd lay down. So tipping the temperature again slows down that heart rate and moves it to more effective parts of the brain and the heart, which are the organs that we need that blood flow to go. The I is increase exercise of approximate 20 minutes, right? I think we all know this skill. This is something our doctors tell us, exercise 20 minutes a day really helps with our stress. But yeah, overall expanding your body's stored up physical energy, burns that cortisol and adrenaline, overall reducing the anxiety and tension and anger. So yeah, when we exercise, we can actually burn out that emotion that we're feeling. And this skill right here kind of ties into the next skill of EMDR that I'm going to talk about. But yeah, I was just telling folks on this call before you all entered the room that, I get very anxious when I have to do presentations. I love them because I enjoy sharing knowledge and being in community with lots of other folks. But at the same time, I have my anxiety. I got social anxiety at times, and doing these presentations is one of these times. So every morning before these presentations, I make sure that I go to the gym and I'm working out for 20 minutes, because I feel the anxiety in the morning when I wake up. I go to the gym, and on that treadmill or elliptical that I'm on, I'm thinking about like, oh my God, this presentation, I'm going to sit there and talk, and I'm going to be on the screen, and I can feel my heart rate going up and I feel the anxiety, but then again, I'm using it in a very effective way. So by the time I end I do about 30 minutes, but by the time I end that, I'm like, okay, like this is going to go great. I'll be fine. I'll be cool, calm, collected, and it helps. So that is another skill we use. And then the last one is going to be paced breathing as well as paired muscle relaxation. Again, so those controlled breathing when someone's escalated or anxious, we can breathe and that helps. But paired muscle relaxation is the pairing or relaxing your muscles while breathing out. The idea is to practice combining the two enough so that relaxing when we're highly emotional becomes easier and sometimes even automatic as you breathe out. This is one of the paired muscle relaxation is one of the hardest skills to teach, only because it does require us to kind of sit. But if we take the time and develop that skill, I can assure you, you will notice the benefits of this. Now, I'm thinking of two cases specifically where this skill has been effective. One, I work with a trans male, about 21 years old, and he has hip pain that he has gone to every doctor for. So finally he gets to me, and the doctors are telling me, we think it's the dysphoria of the genitalia that he doesn't identify with, and it is causing pain. So for him, he went to a specialist and they've told him, you need to do paired muscle relaxation. And so he told me this in session, and I was like, well, are you open to kind of building that skill? Oh yeah. So for him, again, that dysphoria creates, feelings of anger, feelings of like, yeah, the dysphoria, right? Just I'm so uncomfortable in my body, and it's such an intense emotion that it's causing physical pain for him. So in doing the paired muscle relaxation, we do it through the body, but that allows for him to kind of tense up those muscles, relax, and overall relax the parts of the body that he holds that tension in. Little example I wanted to give is I had a 16-year-old female come in. Her grandma was like, she gets aggressive and she had a trauma history. So we did a collaboration session where I brought the granddaughter in to kind of just say, grandma's anxiety's up. We want to know how to help you, because the anxiety was really triggered by the granddaughter. So the granddaughter comes in and the grandma steps out, just giving me time to talk with the youth. And while I'm talking to her, she stands up and she walks towards me, and I'm kind of like where's she going? Like, and then she puts her fists up and she swings at me. And in that moment, I kind of like jumped up really quick and I was like, whoa, okay, like, take a step back, take a step back. And she's like, I just have the urge to hit you right now. The voices are telling me to hit you. So luckily I had like a little punching bag in this room and I was like, why don't you go and punch that bag for a little bit? So she did for a few minutes. It was like a minute, but then she's like, okay, I feel calm. So she sat down and I said, what was that? And she's like, well, I just had the urge to hit you and it feels good to hit. And I was like, oh, okay. So I was like, you want to try a little something with me? She's like, yeah. So I give her 2 of the stress balls, right? And so this one's one where we didn't do a body paired relaxation, but instead I had her clench her fists, hold tight, and then release, clench and hold tight and release. And we did it about 3 times, kind of engaging her in that practice. And I was like, how was that for you? And she's like, oh, wow, I feel so relaxed. I feel like all of the tension I feel in my arms and my wrist and my fists like went away. And so that was kind of the skill we taught, that when she feels the urge to like punch somebody, again, took some time to figure out what was going on there, but it was definitely a trigger that she was experiencing. So she was able to use that to like release that anger and that tension that she felt when she had the urge to hit. And instead she'd clench her fists. And again, after a few sets, she'd be calm and relaxed. So that was another one where I saw like, okay, like this helped. And again, thinking about like just our bodies, right? When we get angry, like how many of us know we're getting angry because we clench our fists or we clench our jaw, right? So again, our body is telling us something. And even little babies, right? When they get worked up, most of them cry and they like scrunch their little fists and, they stretch their legs out. So they are already doing some paired muscle relaxation, the little ones. So I think we can take a note from the infants here
I
and say
love
that
thinking
that skill
about that,
works.
right? Like we're born with this knowledge of what our body needs and then we kind of lose it. And paired muscle relaxation is one of the ways that we can kind of go back to, these lessons that our bodies already knew. And Ali, I want to point you to the chat really quickly because we had a response for the stop skill. Paula says, I work with a lot of people with disabilities who are trying to get services and systems that have been traumatizing. Sometimes they don't even realize they are in a past trigger mode rather than a current situation mode, and the stop method would help a lot. I think that's really important. This, I mean, I see how it's especially beneficial in this scenario, but I think that's true of a lot of people. So often we don't realize that we're in a triggered phase until we are responding already, right? So for so many situations, the stop skill can be incredibly useful. Thank you so much for sharing, Paula. And I want to say that I'm going to be better with the questions next time because I realized that what I should have asked was, how can we use this in the work that you do? But yeah, thank you so much, Paula. And Ali, I will pass it back to you.
Yeah, and just in that stop skill too, we get here at the clinic, we'll have people come in and they, demanding to see a doctor, they're demanding their medication. And, that attitude never, I mean, our staff tries to be like understandable, but sometimes I have to walk down and go, okay, like I get the sense you're really upset right now. Like, let's just take a breath. How are you feeling? Well, I'm feeling frustrated. I'm feeling like you guys don't pay attention to what I need. And then again, the validation, it's like, okay, well, let's see what we can do. Let's plan how we're going to proceed. Do we need to reach out to your insurance? Do we need to reach out to your doctor? So, all right, Eliana, I have a question.
Okay, yeah.
Oh, was that
question in the chat for you, Ali G? The question is about gender dysphoria and exercise and progressive body relaxation. So Eliana, did you want to ask?
I think yeah, thank you. I remember, Ali, I think it was from the conference where you talked about, or maybe it was a separate meeting, where you talked about when people have gender dysphoria that is tied to specific body parts, to be careful around when we recommend exercise, because, for example, somebody who has breasts who it's painful for them to be exercising. If their body is moving, it's a reminder. And I'm wondering if you could talk a little bit about that. And then also around the progressive muscle relaxation, if we are working with a client we know has gender dysphoria with certain parts of the body, if there's any recommendation of like letting them know ahead of time. Progressive muscle relaxation means that we have to focus very intensely on different parts of the body. I can avoid this part, or just giving you a heads up. How would you negotiate those things?
Yeah, no, I'm so glad you brought that up, Eliana, because that is a very true point, right? I'm teaching the skill here of like, exercise and paired muscle relaxation. But yes, definitely in the work I do, and my own experience, right, is that certain movements, having someone sit across from you and walk you through your body, even though that person may not be staring at that body part specifically, when you are experiencing that dysphoria, it is this little white noise in your head that's constantly saying, oh, they're looking at your breasts, if you're a trans man, oh, they can notice how much that is popping out. So yes, whenever we do exercise or paired muscle relaxation with trans folks, again, we want to be mindful that what part of the bodies create dysphoria. And okay, so maybe jumping jacks is not going to be for a trans man who hasn't had top surgery and feels dysphoric about his chest. That's probably not an exercise I'm going to do. So I think there's always the question, right, of like, what exercises are you comfortable doing? And then that's kind of in my intake when I always ask, do you engage in any like physical activity? And if so, which ones do you like most? And that kind of gives me an idea when I develop the intervention to then say, okay, like this is what we're going to do here. But also in my office, when I do paired muscle relaxation, I will ask them, would you like the light off? Because again, even like for someone who's having gender dysphoria going into a shower, very often the solution is turn off the lights or dim them so that we don't have to see those body parts that we're not comfortable with. So definitely want to take an assessment of like, when we're going to think about exercise, like what exercises are we comfortable doing? And when we engage them in these exercises, asking, would you like the lights off? I always like I sit side by side with them, because when I sit directly across from them in conversation, it works well. But in exercise, I am going to pull up my chair right next to them and face the same direction that they are so that they don't feel any eyes on them. And it kind of gives them a little bit of privacy. And again, I'll say, would you like the lights on, off? And that is something we can do there. So I hope that answers that question. And then that second part of the question there of like, can paired muscle relaxation be helpful for these areas, right? Or for gender dysphoria? Was that the question? Yeah. Yes. Again, every person is different, right? And I think we do have to have a very strong rapport with that person because again, they have to trust that, we are safe. And so I always think it does work, but again, you always want to check with the person. And Bella, I think you wanted to add something.
I wanted to clarify the question for you. Actually, the question was, when working with somebody that has gender dysphoria, how do you navigate paired muscle relaxation that may engage that body part? Do you ask them if it's okay? Do you tell them beforehand? Do you ask them if they prefer to skip it? Like, how do you navigate gender dysphoria and paired muscle relaxation?
Yeah. So again, if I'm aware that that's what's coming up, I might not do them in a full body paired muscle relaxation. It might just be specific parts. So most paired muscle relaxations start at the feet and then work up. And in that, I will prep them that this is going to be a full body, so it will ask us to tap into this. And again, because for this person, right, the dysphoria creates physical pain and tension in the pelvic area, in the hip area. For this person specifically, again, I had to have rapport, because the first 2 times I suggested it, he was like, no, it's okay, I'll do it by myself. He's like, oh, it wasn't really that helpful. And I was like, oh, okay, well, like, would you be open to trying it with me one day? And so finally he said like, yeah, I'm open to trying it with you. And that's it. And that's exactly what came up. I was like, how was that for you? And he was like, well, it was good, but that part felt really uncomfortable. But I did it anyway. And like, yeah, I feel the relief. And I was like, okay. So,
and with all of these skills that we teach, all of these things happen in conversation with the folks that you're working with, right? Not everything is going to work for every single person that you work with. And so you offer these skills as options, and maybe these will work for them and maybe they won't. Maybe there are other skills that they feel are more beneficial, and that's fine. But all of these kind of the teaching of the skills, offering these skills, all of these things happen in conversation with the client so that you're not offering something that is going to be, detrimental to them.
Yeah. Yeah. And so, for example, with that youth, I was working with the girl, because her tension and her frustration and anger came out in like the urge to hit. A lot of the paired muscle relaxation exercises we did were focused on just the arms and the leg. I mean, just the hands and the arms and kind of clenching the fist area. We really didn't do full body because again, she was like, 16, her attention span was a little shorter. So I couldn't really fully engage her in like a full body one. But ideally, the goal would be to go through our full body because, like that book, Our Body Keeps Score, our body is tracking the stress and tension, whether we are or not. So when we do these paired muscle relaxations, we can start to feel like, oh, wow, I carry a lot of tension in my jaw. Like it can bring awareness to that. And I love the questions that you're asking, Eliana, and thank you for making that note there of what I had shared in the last training we did. But we can go to the next slide. So the next slide is going to be a 5-minute paired muscle relaxation. For those of you that are willing to do it, feel free. We want to get that set up.
Yeah. So really what we're teaching these skills, and we want to be sure that we also know what they feel like. So if you find yourself in a position where you're able to engage in this paired muscle relaxation, it's only 5 minutes. We'd like to invite you to, and you're more than welcome to do it with your screen off if that feels better.
Yes. All right. So we're going to go ahead and get that video going. I'm going to ring my little bell, 1, just to kind of orient us. On the second bell, I want y'all to take a deep breath in as we begin this muscle relaxation. And then on the third one, if we can go ahead and press play and get comfy.
This is a 5-minute progressive muscle relaxation exercise. To begin with, get in a comfortable position, either lying down or sitting. Let your gaze soften and your eyelids close either partially or fully, and then gently shift your attention inward by taking a few deep cleansing breaths, breathing in and breathing out. Breathing in and then breathing out. Allow your breath to return to its own natural rhythm and pace, allowing yourself to breathe naturally without any control or effort. Noticing the gentle rise and fall of your belly as you breathe in and as you breathe out, allowing your breath to settle you and center you with each inhalation and exhalation of your breath. Now focus your attention on your head. I want you to notice any physical sensations you may be experiencing in your head, any areas of tightness, fullness, tension, or other sensations that you're experiencing. First, simply noting those sensations, and then on the count of 3, I want you to tense your facial muscles as hard as you can for a count of 5 seconds. 1, 2, 3, tense your facial muscles as hard as you can for a series of 5 seconds. 5, 4, 3, 2, 1. Release. Now take a moment to notice what it feels like after you allowed your face to relax and your muscles to release any tension. You might feel some fatigue in those muscles, some tingling or something else. And then gently again shifting your attention to the upper portion of your body, your torso, your arms, your belly, your back, your neck muscles. First noticing any sensations you're experiencing in those areas, any tension that you might be holding, any stress or other sensations you're feeling. And then again, on the count of 3, tensing those muscles as hard as you can for a series of 5 seconds. 1, 2, 3, tensing the upper portion of your body. 5, 4, 3, 2, 1. Release and relax. Settle here for just a moment. Again, noticing any physical sensations you're experiencing in the upper portion of your body after you've allowed yourself to release any tension or stress that you may have been holding in those areas. You may be experiencing a sensation of fatigue in your muscles, tingling, or something else. You're just noticing what's there in an accepting and non-judgmental way. And then moving your awareness now to the lower portion of your body, noticing any tension, stress, or other sensations you might be experiencing in your buttocks, your calves, your thighs, your feet. Taking note of what it is that's there. And then on the count of 3, tensing the lower portion of your body as hard as you can for a series of 5 seconds. 1, 2, 3. Tense the lower portion of your body. 5, 4, 3, 2, 1. Release and relax. Take a moment to be mindfully aware of what it feels like after you've tensed your muscles and now they've relaxed. Again, noticing any physical sensations you might be experiencing in the lower portion of your body. And then quickly scanning your body from your head all the way down to your toes to notice anything that you might be experiencing now that you've tensed the muscles in your body and you have allowed them to release and relax. Feeling calm, relaxed, and centered. And remembering you can return to this meditation anytime that you need to help you calm your body and to help you relax by using progressive muscle relaxation.
That was a little bit on DBT, 2 of the top skills I teach. And then I'm going to switch gears here to EMDR. So I wanted to see how familiar are folks with EMDR. So we do have a polling question. All right, what I have up on the screen is a little infographic on EMDR. There's so many things I can say about it, but I will say that kind of the gist of it, right, can be read on the screen, but also that EMDR has been really beneficial to those with PTSD, right? They found that with veterans who were coming back, that talking about the things they experienced often increased the symptoms. And so EMDR became a method of therapy that helped reduce that trauma response very, very quickly. And so it's the thing to it is kind of in its title, right? That through eye movement, we can desensitize you to an emotion and we can help you reprocess an experience. So again, this was also created in about the 1980s to kind of help with distressing experiences using bilateral simulation. So how it works is that we'll have a person bring up an experience that's caught, or an emotion or a feeling that's kind of really has a strong emotional charge to it. And then through bilateral simulation, which is just when the body is moving side to side in a pattern, kind of like a rhythmic pattern when we're walking, our right, left, right, that is very rhythmic. And through eye movement, right, moving your eyes back and forth is very, it's a pattern of moving side to side. And the power of bilateral simulation is that the brain has 2 hemispheres, the right and the left, right carrying emotion, left carrying logic. And when we are not moving our body in a bilateral movement, we are often set in one part of the brain, right? We tend to either be very emotionally charged or logical. And so when we engage in a bilateral, what that does in the brain is that it opens up pathways of communication. So the little sparks in your brain light up and they communicate with one another. And they found that happens when we go to sleep at night. When we enter REM sleep, that is when our brain is kind of filing away the day and processing what happened. Now, our brain is kind of black and white. It will either process things with a negative core belief or a positive core belief. And in EMDR and in neuropsychology, we believe that the brain is hopeful. If the brain has the chance to reprocess something with a positive narrative to it, it will definitely take it, but it has to be given the option. And when we're in invalidating environments, oftentimes we don't get the validation that helps us process that in a proper way, right? If I stepped off the curb and almost got hit by a car, based on my experience, I may believe it was my fault. Oh my God, I almost died. And then my logic side might say, well, you got off the curve, you didn't see the car coming, you're human, you make mistakes. But again, if I go to sleep and that brain just processes it, based off my experience, it may process as that it was your fault. So when we do bilateral, we can take them, we open up the memory center of the brain, we bring that memory to the forefront of the brain, and then through the eye movement, we reprocess an experience. Again, kind of taking a negative belief to a positive belief. So there's 8 phases to this treatment model. Some therapists are very structured with it, right? You will go to a specific EMDR therapist who has certified in this and solely does this. But again, in the work that I have done, I have found in working with CSEC populations and trans folks that EMDR by itself it's not effective, right? Some people are like, I'm not an experiment, like, oh, I'm scared, like, what if things come up, you're going to hypnotize me. So for me, what I have found in doing trauma works is it does take a lot of trust from the person and that clinician to say, okay, I'm trusting that you can do this, right? So I had, and this is going to be a quick session, but I had one patient who was CSEC and had gone through a lot, and her core belief was, I'm going to die, because the experience she had felt like she was going to die. And so after a couple sessions, we developed some rapport. And so I said, I think you're not able to go to school. You're not able to sleep at night. Can I try this with you? And she did. And in one session, she went from like, I'm going to die. Then she cried and she was like, stop, they're going to kill me. And then I said, let's keep going. So we keep moving the eyes. Then she starts laughing and she's like, oh, the person that was going to kill me disappeared. And now at the end of that session, she walked away like, I'm a survivor. Like, I survived that, like, through my actions. And so that negative experience of I'm going to die was reprocessed with I'm a survivor. And the next day she was able to go to school, she was able to get on the bus, and she was able to sleep. So within one session of that, we were able to desensitize her to that experience and reprocess it with a more positive belief. If we can go to the next slide, please. And then, okay, so what I want to talk about today in response to crisis work, right, and tools that we can use in crisis is the bilateral simulation. This is something that is taught in EMDR as we use it for many things. It can be the eye movement when we're reprocessing an experience, but some people, get a little fuzzy in the middle. So they're like, I don't want to do the eye movement. So we can use tapping. So tapping bilaterally. So I have some folks kind of hug themselves and do this as we talk about an experience. They're talking about a negative experience and they're tapping. And what I have found is that they can bring themselves down from that emotional charge much quicker than if we were just sitting and talking without activating left and right brain together. Because again, the goal is that we want left and right brain to communicate, because when they are communicating, we find the wise mind in the situation. I had one person who had gone through a lot, and it was on Zoom, and she said, well, I feel like I've already moved through that. And so I said, well, let's talk about it. And so she was open to it. So she started doing this, and she was a very logical person, right? She was like, I survived, like, I'm fine, I'm good. I'm going to school, everything's great. And as we were tapping and she was telling me the story, she started crying, and she's like, oh my God, I have to stop because I didn't realize that I had so much emotion around this. And so I was like, well, no, let's keep going. So she kept going. And sure enough, she was like, wow, I guess I've always just logically like justified what happened and just tried to move on from it, but she wasn't processing the emotional part of it. So bilateral simulation really helps us process intense emotions. So again, at that gym, when I go, it's the feeling of anxiety. Maybe my thoughts are like, you're going to suck, or like, you're not going to be that great, or they're going to not, respond well to you. And then at the end of that as I'm moving bilaterally, my brain starts to talk to itself and it says, you know, you're going to give the best you can. Like, you're just sharing your experience. You're not saying you're the expert in this. And I'm like, yeah, you know what? You're right. I'm just going to give my best. So how this works in a crisis situation can be if someone is heightened, right? And we, again, allow that survival brain, that escalation phase to just kind of come back to baseline. And now they're able to talk with us, or they're in that agitation state, the emotion brain. Those are perfect times to start a bilateral. So when I went out on crisis calls with a safety team here in Santa Barbara, I'd go out to a situation, the person would be on the bed, like angry. And I'm like, you know, would you like to take a walk with me? Like, let's just walk down the street and talk it out. Right. And so as we walked and talked, you slowly started to see that the person can, you know, get to the wise mind much quicker. They de-escalate much quicker. So in therapy here, I have got a lot of people to bike, right? Because a lot of people are like, I feel strong emotions. I need to see you every time I feel that. And again, I always teach that we do not need therapy our whole lives. If we can learn skills and surround ourselves with people that are validating and supportive, then that's the goal. So for now, I'm like, you know, what kind of exercise do you like to do? What kind of movements do you like to do? Do you want to tap? And through that tapping, they can desensitize themselves. So I had a woman that went through divorce who was 8 sessions just venting. And finally I said, you know, maybe you like to hike. Like, would you be open to like thinking about this as you hike? And she came back the next session and said, you know, wow, like I was able to get through it much quicker. I had a trans woman whose dad is not accepting of her trans identity. And she also reported that when she hiked, she was able to get to like logic faster and out of her emotion brain. So we're going to use bilateral simulation to either take a person out of logic and help them get to the emotion, or reduce that emotion by walking or doing something bilaterally that can then help them desensitize themselves to that. So we wanted to ask
Ali,
you.
can I direct you to a question that you have in the chat, please? I'm
Yes.
on my phone, so I can't see it, but I know there's one.
Oh, okay. Yes. Is it okay to close out a group doing tapping? This is the butterfly curve. Okay. Yes. So I'm thinking you're doing this one where it's tapping. Yes. Tapping is, you know, grounding in that. Okay. But I'm going to teach you in our next session, because our next session is actually going to build, and it's actually going to talk about this, Anna. So we will be able to talk about why that is so effective to have tappings after session 2. Because again, we're opening up a memory center in the brain when we do the work we do, whether that's talking to someone about what they're experiencing, or in a therapy session, or if we're getting that call, or we're, you know, case manager, right? You're going to have someone that's worked up. So if you can get them to engage in a bilateral, whether it's tapping, doing the butterfly, walking, biking, hiking, they are going to be able to regulate their emotion much quicker. And again, in crisis work, when I'd go out, my goal was always like, let's get this person moving, let's get this person walking. Because if I know for a fact, every time I've gone out there, that when I can get someone to walk and do this work, we get to resolutions much quicker. We get that baseline back much quicker. So this is where I'll kind of wrap up today, because I know we also have to get some last minute stuff tied in. And again, we are going to be building.
Sorry, Ali. A quick little caveat is, if you're working with somebody that isn't able to walk, if you're working with a client that has disabilities, you can engage them in tapping in different ways, like the butterfly method. It doesn't have to be walking. All righty, folks. And with that, thank you again so much for being here with us.
Thank you, Bella, as well. The two of you are just brilliant co-presenters. The resources are amazing that you've put on Linktree. We'll go to the next slide, please. And references. Huge thank you to Ali and Bella. These presentations are phenomenal. Thank you all so very much.
Have a great day.